You're watching Reality Check. Tonight we focus on India's great vaccine challenge. We're attempting to vaccinate billions of Indians as the virus continues to surge, but there are repeated worries that the vaccines are running out. And also, are the vaccines that we're using currently effective against this constantly mutating virus? I had a chance to put this to Dr. Krishna, who's the chairman of Bharat Biotech, which makes Covaxin, one of the two vaccines which are currently being used in India. This was part of a session organized by the All India Management Association, the premier body which looks at management. And also on the panel with us was Dr. Shiv Sareen, who is part of the Institute of Liver and Biliary Sciences here in Delhi and also has been helping the Delhi's COVID task force. And so I began by asking Dr. Ella exactly that, as to what are the challenges he faces in ramping up production, even as we are trying to ramp up vaccinations, and there are multiple complaints that we are running short of vaccines.
It's really honored to meet you, Srinivas Jain. And finally, I think I want to thank Munjal forced me to be there, and I'm really honored to interact. And I think, the two sectors are facing a problem in this country. One is the vaccine manufacturers, and second is hospitals. Both are at the loggerheads of the both. We are facing all the brickbats of the entire system. One wants to make more vaccine, one wants to have more hospital beds, and the other side of it. And it's a very challenging time. One, when you have a disease, some of the employees also can get, their family gets sick. So getting employees moving into the manufacturing facility, everything is a challenging for us. Getting a raw material is a challenging for us. And then I want to say one thing which I've never been told to anybody. The live vaccine and inactivated vaccine, there are two major platforms. The live vaccine is like adenovirus vector-based vaccines, and inactivated vaccine, you kill the vaccine. The productivity of inactivated vaccine is 1 out of 100. If live vaccine can be manufactured 100 doses, inactivated can only make 1 dose.
Right.
So that speaks, the technological platform problems.
And yours is the inactivated.
Ours is inactivated.
Vaccine.
So
yes,
it's comparable. But I think, what we are doing right now is that we had only started with one manufacturing facility in the beginning, thinking when we were doing clinical trial, because we need to have BSL-3 facility. So we had only one BSL at that time. We started that and start doing all the clinical trial and all that. But the second facility got activated. Now two BSL 2+ production facilities also activated. Now we have 4 production facilities activated in Hyderabad. We are ramping up the production right now. And I think, by July, August, we will be able to reach 700 million doses to 800 million dose production capacity per annum. And I think I just want to tell you, Srinivas, that the inactivated vaccine, anybody produced in the world, maximum 150 million doses only. That is Sanofi. Nobody else produced more than 150 million inactivated vaccine anywhere in the world.
150 million doses
is what people produce globally, inactivated vaccine.
Annually, you mean?
Annually. Okay. And we are reaching 700 to 800 million dose capacity. That actually speaks the capability of the Indian company that can ramp up the inactivated vaccine to that extent. So people know 700 million is not a great, the other people can make 1 billion doses. So I don't want to be correlated in that fashion. So I think it's reaching 700 million. And I think the nice thing about this vaccine, it can reach to children's from 2 years and above, but we have not done a clinical trial. Right now we got the approval of the clinical trial. We'll be starting soon on children's from 2 years to older. So I think, India is in a well position. The only thing is the timing was too short for a population of 1.4 billion.
Right.
But I think, I would say strongly, by next 6 months, we will ramp up a lot of platform technologies, a lot of other platform technologies. So we will not be left over behind.
So if I can just ask you, just to put it in perspective, Dr. Ella, you're saying you'll be able to reach 700 million doses annually by the end of the year. At the moment, what is your current production capacity?
We have right now, last month we produced 15 million doses. This month we're reaching 20 million. Next month we'll reach around 30 million. followed by ramp up by 75 million doses.
Okay.
Because we're adding the Bangalore facility, two new production facilities in Bangalore, which are BSL 3 plus facility that is also getting activated.
Okay, because we were trying to do some math about the gap between vaccine production and consumption, and our numbers are slightly outdated. So please correct me if I've got it wrong or if their numbers are outdated. This is I would say about 3 weeks old numbers that we found, that Covishield is producing about 21 lakh doses a day. Covaxin was about 1.6 lakh doses a day. That comes to about 23 lakh doses a day. But we were administering at that time, that number must have gone up, 33 lakh doses a day. That was the target being achieved by the government. So there was a shortfall of about 10 lakh doses on a daily basis. So
10 lakhs is a 1 million doses, I think is a reachable, 1 million dose reachable by June, July. We'll be able to reach 1 million dose per month, per day, 1 million per day. We'll be able to reach by June, July, we'll be able to reach that.
Oh, okay, wonderful.
See, you look at it, they give 30 million doses order to Government of India. We supplied all the 30 million doses for last 3 months.
Right.
April, they want us to supply 10 million and we are ready to supply. Already we supplied 8 million doses. So another 2 million we supply, we are done with the 2 million of this month.
Okay. Just one final question before I move to Dr. Sareen. As far as the whole funding question is concerned, because that's again something which came up, I think Adar Poonawalla also raised it, that there is a question of being able to advance lines of credit to you, make advance payments, because you're trying to ramp up production and because you're producing at this extraordinary time. The government has indicated that they are willing to do some front loading of payments. I believe the figure mentioned was 2,000 crores to SII and 1,000 crores to Bharat Biotech. Have you heard any, firstly, how important is that advance funding to you? And have you heard anything from the government about it, about receiving it?
Srinivasan, we never asked even for production and clinical trial and all anything, so far, we never took any money from the Government of India. Even including our clinical trial, we spent almost 350 crores for phase 2, phase 3 trial. We spent 350 crores, we never took money from the government. So we had we thought it's a moral obligation for us to help the community. You may think it's a philosophical or you say it's political. I'm not interested in that. But I can tell you honestly, as a scientist, it's my moral obligation to help the community. If anything, I can do it. And that's why we never went behind any government for any funding at all for our inactivated vaccine.
No, I appreciate that. I'm just saying that as you ramp up and expand, are you looking for some kind of...
No, money was a secondary. Money was a secondary for us. The problem was getting ready with the facilities, upgrading the facilities to risk analysis to meet the global requirement, because we can't make a vaccine just like that. We need to have, because in WHO, we are pre-qualified company, 5 vaccines. Yeah. WHO pre-qualified. If anything they come, oh, you're not done this project like this. So that means you're not up to the standard. That will get into trouble for us. So we need to follow certain standards of global standard. And we followed that. We upgraded the 4 facilities. Now it came up the facility. That's why it got delayed. But we are never lack of money. No, I think we have enough funds. And we are, thanks to rotavirus vaccine and typhoid conjugate and rabies, we are doing very well in the project. I think we may be poor people, but not short of good heart.
Rich in other respects. Dr. Sareen, why did you come in here? Because I think the thing that has become a very urgent question at this time is about the manner in which this vaccine rollout has happened. The government has set ambitious targets, but halfway through that, we're seeing the shortage of vaccines. We're seeing some hospitals and vaccination centers having to turn people away. We're also seeing vaccine hesitancy. People are still not buying in. What do you think are the lessons here? Has there been some amount of mismanagement? Has the planning not been sufficient in the manner in which it has been rolled out?
The vaccine is actually what? It's giving you a dummy run of the virus actually coming. So body is ready with its army of cells, army of antibodies. So you can prevent when the actual invader, the virus comes. But it is not a lock and key every time that everyone has a good lock and when they come, the virus cannot open. That lock is not so strong. So please remember that the vaccines that we have are not totally protective, 70-80%, but 20% of the people may still get infected. The urgency of vaccination is there, and I think India, in my knowledge, probably is the only country other than maybe Israel or maybe Bhutan or so, where younger people 18 and above are likely to get vaccine. So India is a country which is maybe the vaccine manufacturing hub of the world, but we have challenges, and I have some suggestions for overcoming, maybe to Dr. Ella and maybe through you to others. And one of the ways is that we should make IPR, intellectual property right, less important. We should give to multiple manufacturers, like Dr. Ella can make maybe 60 million dosages, but maybe the country needs 600 million. We have a huge population. So allow the way we can manufacture, we have to grow together. Like in the US, there was 18 billion US dollars were given by the US government under Operation Warp. 18 billion in the beginning to 9 manufacturing companies without their asking. Without asking, the money was given so that people can ramp up their manufacturing capacity and innovate into new vaccines. So I think the government has come up with some money plan, but I think it's a bit late. We could have done it maybe much earlier. And if we could have ramped up our vaccine production earlier, we would have had maybe much better availability of vaccine. We could have opened this to the people at large. So people can buy the vaccine of their choice. The people can get it in the place of their choice, and maybe more effective vaccines would come.
Dr. Ella, I think the big question really is about whether our 2 existing vaccines, including yours, Covaxin, are they effective against these variants? Do we know anything about that at all?
Srinivasan, we know about the UK, we know about the Brazilian P3 strain. Yes, it cross neutralizes. South African, we don't know yet. We are working with South African country. We sent some sera to them. We are looking at those aspects of it. Coming to Indian double mutant, we don't have knowledge, but we'll have data probably in another week. So I'll give you optimism in a different way. Okay. So we are using a Wuhan strain right now as a vaccine production. Suppose if Indian government feels, regulatory feels, the double mutant might be an important vaccine candidate. I can, just like a flu vaccine, I can hop in this strain, take it out, the Wuhan out, put it back into production and start manufacturing that strain. Right. It's possible. It's a regulatory, and the government has to take the decision, not as a manufacturer. If the regulatory takes a decision, so we have India double mutant is a problem, or South African mutant is a problem, and we can replace it back fast with like a flu vaccine strategy. That's a nice thing about inactivated vaccine. I can plug in quickly and ramp up, replace back the production in 1 month and get it to the field. There's a flexibility, but that government has to take a decision, not us.
That has to come from the government side.
Yes.
Okay, but what you're saying is we're still waiting on the data to be able to gauge whether the vaccine is efficacious against this Indian strain, double mutant, whatever you call it.
Double mutant, we will be having by end of this week data on this matter coming out. But I don't want to press people to come again, budge me. You said 1 week down the data. So it takes time for us because it has to be worked in BSL-3. If any press wants to have quick data, I don't mind sending them into BSL-3 facility.
I don't know who wants to take that risk.
But we are very serious. We are very serious about it.
Right.
Want to know the data of that. If it is not working, how do we put the regulatory people into the game and change the strain quickly, put it back? So we are interested. We don't want a vaccine which doesn't work to the society. We don't want that.
You know, one of the things that's happening to ordinary people is that they go out, they take the vaccine, perhaps 1 dose, perhaps even 2 doses, and they still get infected. And that makes them question the entire business of getting vaccinated.
I'll put it very simple. Whether it's a Pfizer mRNA or the adenovirus vector-based vaccines or the inactivated vaccine, all of them vaccines, injectable vaccines, only protect the lower lung, not the upper lung. So many people do get the disease, but it will not be lethal. They don't need to have an hospitalization. We are seeing that from Pfizer to adeno to Johnson and to Bharat Biotech, all vaccines, you will get the protection against seriousness of the disease.
Okay.
So that is one of the drawback of the all injectable vaccines. It is not that we want 100% protection like child vaccines, but it doesn't happen. But it's people still after vaccination, they still have to wear a mask, and I think that's a must because you will have a nasal infection still. If you look at a vaccinated person, you look at the nasal, you will still have some infection and you're still transmitting. That's why even British journals clearly said all vaccinated people still will have infection and transmission. You're not blocking the transmission yet. And only that will be blocked only with the nasal mucosal immunity. The mucosal immunity is the only one which can block the transmission, but not injectable vaccine.
This question of what is causing some degree of vaccine hesitancy even now. We had Abhay Soy of Max Hospitals last week on the program. He said many of his centers are still empty even though the virus is climbing because people still have hesitancy. They still are believing a lot of, sometimes it's misinformation, sometimes it's old rumors that are still creating doubts in their mind. This might be a good opportunity, Dr. Ella, to address some of those concerns. I think some of it could be the carryover from the time when the vaccines were cleared by the government. This was in early January. There were some questions over whether at that time phase 3 data was still not in. The vaccines have been cleared in haste. The other is, Dr. Ella, when you get reports from other countries, for example, you're exporting to Brazil. Brazil has raised some questions on Covaxin. That also creates doubts in people's mind. So how would you address that?
I think that's a good question. So when it gets global, it gets to nationalism. And each country wants to play its own politics. Okay? And each country wants, it's not the regulatory, they want to do some strategically, okay, delay the Indian one. It's not the regulatory, but they delay some strategy. So nationalism comes in, and I don't want to tell publicly what happened in Belgium. Maybe I'll give a call to you and tell you what has happened. Brazil. Brazil, I'll call you and tell you separately. It's not good to tell in the public media. So it's a sensitive issue. But I will tell you what is that. But it's more of a nationalism of each country. They're playing that game. And each country wants to defame the other country and their vaccine strategies and all that. It's a global phenomenon. We don't have to worry about it. And we have to keep moving on. And that's one thing. About the mutation, what Dr. Sarin was telling, look at it, Srinivasan. When you're going on a highway, there was a blockage. When you have a blockage means people are vaccinated, the virus cannot go in the highway. Now what do you do? The Google map says you take the diversion right side. So it has to mutate and go to diversion. And then when it's going diversion, well, you don't find any Srinivasan Jain or Krishna Ella, it didn't find. It has to find somebody else. So it has to find a children, it has to find an animal, or it has to find a person who's not vaccinated. Okay? So it's a simple logic. It's nothing. And also RNA viruses are highly recombining. Okay? We call 10 to the power 6 log. So DNA doesn't mutate much. Whatever little one, not even 0.00001% mutation. That is what you get, people get cancer and other things. But it doesn't mutate DNA. That's why we're still human beings. If RNA mutates 6 logs, 600 times it can mutate. Wobble. It's so much wobbling. And because of that recombination, you don't have to scared about it, but it's a part of the game of this mutation. So people, you ask me a simple question, is it we are lacking as India, as a country? I don't think so. Look at US. CDC has got all the data of Los Angeles, Las Vegas, South Africa, Brazil, everything. What is it they have done beyond that? Nothing beyond. You look at UK. They have UK variant strain, your South African strain, all those data are there. But what did we do? Nothing. So I think, we as a country, we are always looked down. Oh, something we are not all right, we're not all right, we're not all right. I mean, that's good to have that pressure to have it on us. But that is not the truth. Scientifically, we are also looking at it and publish the papers and that it mutates, it cross-neutralizes the strain. Nothing less than that. So I will leave it there. Any other question, I'll take
it. Yes. Just one quick question, Dr. Ella, which is to do with the fact that now as the government has opened up the vaccine procurement procedure, now state governments can approach you and other private players directly private entities like hospitals can also approach you directly. How will you meet those challenges where there's increased pressure now from multiple domestic customers, but you are also trying to export? There's an export demand as well. How will that work?
I really don't know. I want to give my position to Srinivas Jain. So whether you can take over my position, I'll be very happy. That is the situations we are in right now. Since yesterday night onwards, so much of calls. So before that, we had press calls. Now we have government calls, too many government calls. We are under pressure because we need a commitment to the government of India. And then government of India has frozen some stock. And then, so they are very intelligently blocked all the production capacities. But now they left it to states. You figure out now your issue. So I think we are in a lockhead now. So I don't know how we are going to all pursue this, honestly. We need time to figure out the issues, how the government of India are going to help us on this matter. Because they need to help us, how we can move part of the production capacities, move to some of the states and the private marketing. But certainly I was told that even the private corporates has to take a vaccine, they still have to go to hospitals and use a COVID software through private vaccination, through Dr. Sarin under supervision. It has to happen like that. So I think they're looking at like that angle.
Dr. Just again, in conclusion, that now that you will have the freedom, I believe there will be greater freedom in terms of negotiating prices because earlier with the government it was controlled. I believe Covaxin is about 209 rupees a dose. That's the government negotiated price. Now that there'll be a greater freedom of negotiating prices with different entities, state governments, private entities, is that something that you think would be important for you? That were you facing pressures to produce at this price? And also what would be a more realistic market price in your view?
Realistic price as a company, we would like to have the maximum possible. So we want to recover as much as possible all the clinical trial costs and all other costs and then put it back for R&D. It is not to, I never give a dividend in my company. I'm still living simple living. So I want to keep the money for any future pandemic vaccines. We are working on chikungunya, Zika, NTS and H1N1 new flu vaccine problem. All that we are working, we need a cash. There's no question about that. It's not that we don't want a cash. We want cash for future R&D. But we are going to have a complex situation. How is the central government pricing? How is the state government pricing? How is the private market pricing? It's going to be complicated issues for us right now. So rabies vaccine, we used to sell to the state government. Each state government is a different pricing based on the volume, logistics, cost, all that we take into consideration and what time the delivery they wanted. All that we take into consideration, rabies, we have knowledge of working with the state government. But certainly the private market, we work with children and working with adults is the most dangerous. Children are easy. You give a vaccine, the baby cries, you just show a toy, the baby will keep quiet. Adults are dangerous people to get vaccinated. So they are worse people to get vaccinated. So I think we're going to face a lot of problems with the adults vaccination and it's going to be challenging for as a country, as a manufacturer.
And no, on the pricing, you're saying it's going to be complicated to try to negotiate with all these different entities, is it? On how
Yes.
do you arrive at a price?
I don't, usually the rabies vaccine, the state government might have to call for tender only. There's no choice. Because, they will have accounting process, whether it is how you would decide the pricing. So that problem is going to come in. So state government will call for a tender and then they select the parties, how they're going to do it. They have to find a mechanism. Because they can't be just without tender. They may not have to go without just buying from somebody.
Thank you, gentlemen, so much for joining us. It's been a fantastic conversation.